Alcohol septal ablation is a very important treatment alternative for patients with hypertrophic obstructive cardiomyopathy. As you may know, many patients with hypertrophic cardiomyopathy undergo septal myectomy to relieve the obstruction. Alcohol septal ablation is an alternative not to replace the surgical myectomy, but especially for the patients who are at high risk for surgical myectomy, this is an important alternative. If you look at alcohol septal ablation, it treats the septal pathology. As you may know, many patients with hypertrophic obstructive cardiomyopathy have problems not just with the septum but also with their valve, papillary muscles, which contribute to the obstruction. Of course, the alcohol ablation will not treat these pathologies, but it will treat the septum only. Therefore, proper selection of patient is critical to get the best outcomes. However, if you get very good outcome, the symptom relief is very similar to surgical myectomy, and the reduction in the gradient is also very similar to surgical myectomy from baseline. We did a meta-analysis to study this, and we found that even the short-term risk of death is also similar between alcohol septal ablation and surgical myectomy. Overall, this is a treatment alternative that you should keep in mind if surgery seems to be a higher risk situation, especially for people who are older, who have other comorbidities that make surgery more difficult, and where recuperation from surgery is a problem, especially the morbidity from maybe lung disease, neurovascular disease, or other organ malfunctions.